Many of us consider hair to be part of our identity. The shape, the cut, the color. It's part of who we are. Our hair not only forms our identity, but it is also tied to our confidence and self-esteem. By the age of 60, over half of us, both men and women, will experience some degree of hair loss. There are many options for thinning hair, from surgery to shampoo and everything in between. 95% of all hair loss is genetic and is also known as androgenic alopecia. Androgenic hormones are present in both males and females and are chemical messengers in the body. The hair shaft extends into the subcutaneous tissue. At the base of the hair follicle is the bulb, where cell division occurs. And at the base of the bulb is the dermal papilla, which touches the blood supply. Blood vessels bring nutrients to the bulb and deliver hormones that modify the structure and growth of the follicle. The oil gland of the hair follicle produces an enzyme that will transform testosterone into dihydrotestosterone. Dihydrotestosterone, or DHT, is a hormone that plays a major role in both male and female pattern baldness. DHT binds to hormone receptor sites deep in the hair follicle. Under the effects of DHT, vital nutrients cannot be absorbed and therefore healthy hair growth cannot occur. The follicle will start to shrink and continue to do so as it receives less blood supply. Decreased nutrients means decreased keratin production and cell division. Miniaturization is the progressive shrinking of the hair follicle. Hair grows for shorter periods, becomes lighter, finer, and smaller until it reaches the vellus stage. The two most common treatments for thinning hair are minoxidil, which is a shampoo, and Propecia. Minoxidil, which is the brand name Rogaine, stimulates miniaturized hair follicles, increasing the size of the follicle to help regrow thicker hair over time. Results take about 4 months of twice daily washing. The mechanism of action is unknown, but it is believed that it dilates blood vessels, which improves blood supply to the follicle. Side effects are uncommon, but can include scalp irritation, headache, dizziness, chest pain. It is generally well tolerated. Propecia is an oral treatment for hair loss. It prevents the conversion of testosterone to DHT. Although Propecia is FDA approved for hair loss, it has many side effects and contraindications. Platelets are blood cells responsible for the wound response system in the body. Platelets are first responders and will go to an injured vessel and seal it over, and then release growth factors that will send out signals to the body to promote regeneration and healing through an extremely complex set of cellular events. Platelets will release over 30 growth factors when they are activated, 5 of which play vital roles in the production of hair growth. Platelet-derived growth factor promotes blood vessel growth, cell replication, and skin formation. It plays a major role in the formulation of the hair shaft. Vascular endothelial growth factor promotes the formulation of blood vessels. Epidermal growth factor promotes cell growth and differentiation, blood vessel formulation, and collagen formation. Fibroblast growth factor promotes growth of specialized cells and influences the growth factor that is responsible for keratin, which is the protein that hair is made out of. Transforming growth factor beta promotes growth of the matrix between the cells. And last, insulin-like growth factor is a regulator of normal physiology in nearly every type of cell in the body. A strong topical numbing cream is applied to the scalp and covered with a surgical cap for about 20 minutes. 10 to 20 cc's of blood is drawn from the arm and centrifuged to separate the platelets, which are then extracted for topical use. The numbing cream is washed from the hair and then the scalp is sterilized. Platelet-rich plasma is topically applied to the scalp. Section by section, plasma is dripped onto the scalp and followed by our automated microneedling device. The device creates a channel into the dermal layer, where the platelets can begin the process of wound healing, which, as we earlier explained, utilizes the same growth factors as follicular restoration, promotion, and production. Using our prescription strength numbing cream, this treatment is relatively painless. Upon the completion of the treatment, a surgical cap is again placed over the area. Patients are experiencing incredible results of up to an 80% increase in hair growth with hair restoration therapy with platelet-rich plasma. Studies show improved results with doing this treatment in conjunction with minoxidil. In a review by realself.com, 100% of surveyed clients are happy with this treatment. Most clients require one treatment per month for 3 months and a maintenance treatment every 6 to 12 months. This treatment is for thinning hair. It is also good for clients with receding hairlines. However, it cannot be used if you are completely bald. You must have follicles present in order to regrow hair. If you have had a hair transplant, this is a great treatment to improve transplant success. Hair restoration with platelet-rich plasma is safe, cost-effective, and yields impressive results. This is a great new option for thinning or receding hair for both male and female clients.